am really, really excited for today's talk because it is something that patients ask me every single day in clinic. There's a lot of stuff, misinformation, altered information, confusion about fillers on social media, Instagram, TikTok. So I have been dying to give this talk, and I've been preparing for a month. So buckle in. I hope you guys are ready. For those who don't know me, I'm Lisa Ishii. I am a board-certified dermatologist here in Chapel Hill, North Carolina at Aesthetic Solutions. And I am really passionate about this topic because I perform a multimodal approach to the anti-aging rejuvenation journey. We're really lucky enough at Aesthetic Solutions to have a lot of different tools in our toolbox, and filler is a key part of that. So when people talk about filler being the bad guy on social media, it makes me really sad. So I'm actually really, really excited to have this talk today. So this is our agenda for the day. I am going to have a Q&A session at the very, very end. So if there's any questions about specific slides that come up, just go ahead and put it in the chat, and I'll be able to kind of talk about that a little bit more at the end, and I'll get to all your questions at the end. Also, it is going to be a little bit more of an academic talk today. So I'm going to talk about a few different studies during my talk, and at the very end of the talk, I will actually have a list of the studies that I talked about so that you can take a screenshot or take a quick photo if you wanted to look into those studies a little further. So let's get into it here, and we're going to talk about what exactly are fillers. I think it's important to actually define it first. So the word, quote, soft tissue filler is actually pretty vague, and it refers to any substance that can be injected into the skin to enhance the facial shape and volume. So today's talk is going to focus mostly on hyaluronic acid gel-based fillers, and I think that's what a lot of people think about when they think about fillers. But fillers actually also include things like biostimulators, that's your Sculptra, your Radiesse, and back in the olden days, it included things like collagen, and it also includes categories such as fat transfer. Okay, so when we talk about hyaluronic acid gel-based fillers, it's actually not one size fits all, and there's a lot of different types of fillers in terms of properties that serve different purposes. But in general, I utilize hyaluronic acid gel-based fillers to recreate bony structure or fatty structure that we have genetically lacked or have lost with time. We might utilize it to help build back symmetry. We might utilize it to smooth down fine lines or even etch lines. And more recently, it's been used to actually provide some hydration and suppleness into the skin. So that all seems pretty good, right? So how do we even get here where we have all of this filler misinformation and filler fear? I think a few different things. So number one, we spend a lot more time on social media where a lot of people can just post what they want. And then as it's becoming more common to actually undergo aesthetic treatments, and the stigma behind aesthetic treatments is starting to go away, more people are open to posting their both good results and some disappointing results. So we see a lot more of this naturally as we scroll around on social media or spend time on the internet. Another thing is that our industry is actually very, very interesting. I am a board-certified dermatologist. I did a fellowship in cosmetic dermatology. So I did a full extra year to become an expert on this stuff. But that's not the case for everybody. So it is a rapidly growing, inconsistently regulated industry, meaning that you might be getting your procedures from an expert, or you might be getting your procedure from someone that took an online course or even like a weekend course and then suddenly call themselves qualified to do the procedure. So, just like I always kind of make this analogy here, if I needed heart surgery, I'm going to go to a cardiac surgeon, right? I'm not going to go to someone that did heart surgery training online over the weekend. I'm going to go to an expert. So, you would think it's the same about our industry, but it's not. So I think when people start going to non-experts, we get inconsistent results. And because of these inconsistent results, unfortunately, filler became the scapegoat. So people see, quote, bad work, and it just gets automatically blamed on filler. So let's dive right into the myths. I actually have 5 of them. So like I said, if there's any questions, go ahead and throw them in the chat. But myth number 1, filler lasts forever. So you guys may have seen this photo or image online. It was popularized on TikTok, but it is an image of a person who underwent filler treatments for years, and they happened to get an MRI. And they were shocked to find out that even though they hadn't gotten filler in years, they had all of this filler left remaining on the face. Okay, so why did this happen? So first of all, filler can actually last a lot longer than the FDA indication states. So every time we do a study for fillers, hyaluronic acid gel-based filler, typically we come up with how long we think that filler is going to last, or on average, how long that filler lasts in that study. Okay, so a lot of times it's somewhere between like 9 and 18 months. That being said though, filler gets broken down differently in different people. So some people might notice that their filler lasts a lot longer. In people that might have a little bit more active lifestyle, higher metabolism, you might notice that the filler does indeed go away during that time frame. But if you actually take a look, some studies have shown that filler can stick around for 2 to 15 years in some patients, okay? In the case of Sculptra, which is an aside, we have known that the particles last, somewhere between, we tell patients to get it every year, but you've been able to visualize Sculptra particles for up to 30 months. So, it doesn't necessarily mean we do this like clockwork. I think that's actually when we get into trouble. And when we see patients like this image is when we do it like clockwork. We treat it like a neuromodulator. So neuromodulator, something like Jeuveau or Botox, we know that in 4 months can be out of the system, right? But that's not the case for filler. Just because we say, okay, let's have you come back in 12 months, doesn't necessarily mean that you actually need to get the filler done in 12 months. And the way I practice, I might start taking a look at you around the 1-year mark. But let's say, today we injected cheeks and lips. 365 days later, we're not going to do that same thing if I don't feel like you need it. I might look at you and say, oh my gosh, your cheeks still look amazing and your lips are still holding. There's no need for me to just keep going. Okay, so I think that's when we run into trouble, is when we do filler like clockwork year after year after year, and then suddenly we have a lot more filler in the face lasting for a lot longer. So does filler last forever? No. Hyaluronic acid is something that your body will naturally break down, but we break it down at different speeds. So we should never be performing filler like clockwork year after year if you don't necessarily need it. Okay, myth 2, filler always migrates. So let's first define what filler migration really means. Filler migration means that when we inject filler into an intended area, that filler shifts into a surrounding area that we didn't mean for the filler to inject. It does not mean that the filler injected into the lips crawls through your face and suddenly it ends up in your forehead. That is impossible. That is false. That will never happen. Okay? But filler migration, you actually do see, and we actually see it. There's certain areas that are going to be a little bit more riskier for filler migration, which we'll talk about. But there's actually a few different reasons why the filler migration risk might increase. First of all, filler migration is exceedingly rare, full stop. However, if that filler is injected into the incorrect plane, sometimes that filler can shift into a plane that it wasn't supposed to be in the first place. So like I said at the very beginning of the talk, filler is typically intended to mimic things like bone and deep fat, right? So if we're trying to mimic those structures, we're trying to actually inject it into those structures. However, if we're not as familiar with the anatomy, or, unintentionally it was injected into the wrong plane, it might shift into a different area because that area isn't meant to carry, say, volume, right? Number 2, product choice was not ideal. So like I said earlier, there's actually a lot of different types of hyaluronic acid gel-based fillers on the market, and they all have different properties, which is great because you don't want a one-size-fits-all approach, right? You don't want to put the filler that's supposed to mimic your nice cheekbone into the lips. That'll be crazy. So there's a lot of different choices for us to make and a lot for us to choose from. So if you're not as familiar with the product and you accidentally choose the wrong type and you inject it into an area that the filler is inappropriate, that filler actually might migrate out. Number 3, too much product for the anatomic area. I'm going to use lips as an example for this one. If you naturally are born with thinner lips and you are going for a more full lip, there is a constraint at how much lip filler that you can inject into that area. So if you are naturally coming in with thinner lips, yes, of course, I can naturally enhance them a little bit, but if your goal is to look like Angelina Jolie, that ain't going to happen because there's simply just not enough space in the lip for that to work. So when there's not enough space and you just keep injecting, going for kind of unrealistic goals, that filler has to go somewhere, so it might shift out. Okay? And then finally, potential cause is bad luck. So even in the hands of the best injectors where we're, injecting into the correct plane with the right product in appropriate amounts, sometimes we get bad luck and it will shift into an area where we didn't need to inject it. Now, the more important thing is your injector or your dermatologist knows how to deal with that issue, right? You run into trouble if someone says, oops, too bad, we don't know how to deal with it, and they kind of shun you away. Make sure your injector knows how to handle that if it were to happen. Now, I touched on this a little bit where anatomy does play kind of a big role. So lips is an area that typically there's a constraint depending on your native anatomy. The under eye area as well is somewhere where I tend to see a little bit more filler migration. So number 1, I am extraordinarily picky about who I offer under eye filler to. This should not be the first place that your injector is immediately going to fill unless you are a perfect candidate for it. Why? Because number 1, the under eye area is the skin there is the thinnest part of our face. So anything that we inject under there is going to be a little bit more visible if done in inappropriate amounts or inappropriate technique. I always tell my patients, whether it's 2 weeks or 2 years, at some point the under eye area has a risk of it looking kind of funny. And it's because of that thin skin, but it's also because it's an area that tends to undergo lots of shifts and changes as we get older. And because the under eye filler may be lasting a little bit longer than we originally thought, right? If the area is changing as we get older, it can shift. So I am very picky about who I offer under eye filler to. So, does filler always migrate? No, it is very, very rare, but migration can happen, but the risk can be mitigated by selecting the right product for the right location. And if we don't go for unrealistic proportions and unrealistic expectations that are impossible for your body's anatomy. Myth 3, you can't get a facelift after filler. So this is a very, very interesting topic. And it's something that I'm very passionate about because I collaborate with my plastic surgeons all the time. So first of all, I want to preface this by saying injectables, facelifts, lasers, all of that are all completely different treatments that are targeting different aspects of the aging process, okay? Now, I actually sent out an anonymous survey, believe it or not, to a lot of my plastic surgery colleagues that do a lot of facelifts and neck lifts because I was personally curious about what they thought. The consensus that I got was yes, certain fillers can affect structures underneath the skin, but an experienced surgeon can get around it and already know how to work around it. And part of the reason why that is because as we start seeing the aging process, most of us don't go straight to facelift, go straight to neck lift, right? So a lot of us will utilize these other tools to kind of mitigate that aging process before we even jump to facelift. And in fact, a lot of your plastic surgery colleagues will also offer fillers and whatnot in their clinic too, because they know that there's a place for that. So I think it's I think it's a disservice to patients to say that you can't get a facelift if you've had filler before, because a lot of us aren't ready to jump to a facelift quite yet. That being said, I think it's really, really important to disclose to your surgeon what aesthetic procedures you've had in the past. So, it should be a no judgment zone. If you've had filler, if you had sculpture, if you had certain lasers, let them know, because it's very helpful for them to prepare for surgery. At the same time, if you are considering getting a facelift or neck lift in the next 6 to 12 months, please let me know, because what I'm probably going to tell you is, if you're going to plan on getting your facelift in the next 6 months, save your money, wait, don't do the filler. I would rather you get your facelift, heal from that, and then apply the filler afterwards, after you've healed, on your new and improved facial architecture and shape for further improvements if we even need it. So, can you get a facelift after filler? Yes. A skilled surgeon will be able to work around your prior filler, but timing is going to matter. Please tell your dermatologist, please tell your plastic surgeon about prior treatments and future surgical plans, so we can make sure we time things around you appropriately. Myth 4, lasers will melt your filler. So this makes me so sad, because as you guys know, I love lasers, and I, do a multimodal approach where a lot of my patients are actually getting both of these things. So first of all, let's take a step back, and I want to review the kind of skin architecture with you. So look at the cartoon on the right with me. So this is kind of your basic skin layers. So the epidermis, that top layer, is what you're seeing with the naked eye. So when you look down at your skin, you're looking at your epidermis. Okay. The dermis is a middle layer, where that is mostly where your collagen lives. That is usually where your blood vessels live. Okay. And then underneath that is the subcutis, which is kind of your superficial and deep fat. What's not shown here is underneath all of that, you might have muscles, you might have bones. Okay. So lasers are extraordinarily specific, which means that, especially if we're targeting like brown spots, tattoo ink, or even redness in blood vessels, we are typically having that energy absorbed up by those structures only. When the correct energies are used, the energy is not randomly getting absorbed up into the filler. That's crazy. Where people get a little bit more nervous is if we're using like a resurfacing laser, something like collagen building lasers, or lasers that help clear out sun damage, something like your Fraxel, Clear and Brilliant Halo, things like that. People get a little bit nervous because they say, well, isn't that kind of targeting a lot of different layers? Well, yes and no. You guys remember that I said earlier that filler is typically placed into the fat or bone, okay? Or on top of the bone and into the fatty layer, because that's what we're trying to mimic, okay? Your lasers, we're not trying to target your bone or your fat. When the correct laser energy and laser treatment settings are applied, we are targeting the epidermis and dermis, okay? So we are not even in the same layer as the fat or the bone. There are some caveats, though, because there are some fillers where we actually want to inject a little bit more superficially into the dermis. Now, some studies have shown that hyaluronic acid fillers are largely unaffected by most resurfacing lasers. So that's great, okay? However, some studies show that there is some maybe heat-induced damage to hyaluronic acid fillers with other energy-based devices, so non-laser devices. So this is talking about radio frequency and so forth. But then there's other studies that also don't show damage. So we're not sure, okay? That being said, though, none of these procedures should ever be targeting the fat, which is where a lot of the filler is placed. So again, it doesn't matter if it's lasers or energy-based devices. If you are placing it, and if your technician or your physician is utilizing it in the correct plane, it should not even be touching the filler or coming near it, okay? In the case where I am selecting to inject the filler a little bit more superficially, like the studies show, it's probably going to be fine, but to be safe, I will typically perform the appropriate device treatments first, letting you heal, and then kind of fine-tuning on top with the filler if I feel like I'm doing it in the exact same plane. So myth number 4, Will lasers melt your filler? No. When performed correctly, lasers and energy-based devices will not even be in the same skin layer as your filler. However, in the case where the filler is placed more superficially, I would offer the device treatment first, always, just to be safe. Okay. And then last myth, you guys. Filler will look unnatural. Yes, I think this is a great kind of last myth because all of what we talked about before, I feel like leads up to this. Why is this an issue? It's because we are nervous about looking like this. So I actually went into ChatGPT and typed in filler face. Please make me a cartoon. And this is what it came up with. And you see people that look like this. And I think this is what scares people. Okay. This should never happen. When filler is done artfully, it should be undetectable. For every person you're seeing that looks like this, there are dozens of other people out there that you're not even clocking because their filler is undetectable. They might look great and they might look really natural, and you're not even seeing it because it should be undetectable. The goal for filler is to always look refreshed, not done or different, okay? So why do people end up looking like this? Why is that? So a few different reasons. Number one, if you rely on filler alone when it is not a filler problem, sometimes you'll look like this. For instance, if you have kind of crepey skin, right, or kind of a lot of little lines on the skin, and your solution is, let's just fill the skin until the skin is stretched taut, obviously you're going to look like this because those etch lines, that crepey skin is really more of like a laser and energy-based device problem, right? So, you know, in a clinic that's lucky enough like us, where we have a lot of different tools in our toolbox, we don't have to rely on this technique where we're just relying on filler alone. But if you rely on filler alone for a non-filler problem, you will have a risk of looking like this. Another issue is if we don't know when to say no to a patient. So I did a post on this on my Instagram, and I say no to patients all the time. And it's not because I'm trying to be mean or rude. It's because if I don't think it's number one, a filler problem, or I feel like you don't need filler, I'm just going to tell you no, because I would rather you look natural and refreshed and realistic rather than trying to do filler just to appease you or please you. Okay? We already touched on this, but again, if we have unrealistic goals or expectations, we're going to start looking like this. So there's something on social media that I saw lately. It's called look maxing, and it's like utilizing fillers and certain supplements to like really get a intense look, like the sharpest jawline you've ever seen, like the big thick chin. And I think it looks a little, frankly, unnatural and a little bit crazy. If you have unrealistic expectations that cannot be achieved with your natural anatomy, but we try to go for it anyway, of course you will look unnatural. And finally, we are trying to look like another person as opposed to just a refreshed version of yourself. So I have a lot of people that are first time to aesthetics, and they come in with almost just like a Pinterest board. And they say, ooh, you know, I want to look like this celebrity, or I want her lips, or I saw this person on Instagram and I want to look like her. Again, if your anatomy doesn't support it, I'm not going to offer it, because that's when you start to look unnatural. And finally, it is not on this slide, but I think it's important to know, or for your provider to know, if it is a filler issue or if it is a surgical issue. I recommend patients go see my plastic surgeons for a plastic surgery consult all the time if I think they're going to be a better facelift candidate, because filler will never take place for a facelift, okay? So if I think you are going to be a better facelift candidate, I will refer you, because I'm not going to try to do the work of a facelift with filler, because that ain't going to happen. So will filler look unnatural? No. The goal of filler is for it to be undetectable if used correctly in the right hands. You should look refreshed, you should look healthier, you should look more youthful, but most importantly, you should still look like yourself. So I actually want to go over some before and after photos for you. These are going to be more subtle cases because I want you guys to see what filler can do and still have a natural, realistic result. So this is one of my patients here. She was actually concerned by her under eyes. So the left side is the before, the right side is the after. And she says, I just look tired. And I have this kind of poof under my eye. It looks like a bag. When I took a look at her, yes, I saw what she was talking about, but I knew anatomically that it was more of a cheek volume loss problem. So we did one syringe of hyaluronic acid gel-based filler to her mid-face to better support the cheek, and then suddenly that poof looks more camouflage. I don't feel like I need to go into the tear trough to correct the issue because it wasn't a tear trough problem, but you can see that she still looks refreshed, still looks natural, still looks age appropriate, right? And this is subtle. This is how filler should look like. So this is one of my favorite before and after photos. This is courtesy of our medical director, Dr. Sue Ellen Cox. But this is a long-term result, okay? So this is 2019 to 2026. And I really like this because look how much more refreshed she looks, right? She just looks still like herself, but she just looks refreshed. Another key thing too that I always like to point out is it is a long-term project. Okay, we are not trying to go from the left picture to the right picture overnight because that's when you will start to look funny. Okay, and this is another great example of why, we talked about all these myths, filler lasts forever, filler always migrates. But when you see cases like this, long-term cases, you get reassured that when done correctly and when done judiciously, filler will look good even in the long run. So another case of mine here. So this is a patient that felt that she was getting more and more gaunt. So there's a secret here. So she was going to a different clinic and they were actually injecting something called Botox or Jeuveau into the masseters. Okay, Botox and Jeuveau is not a filler. It is a neuromodulator. But when injected into the masseters, it relaxes down your masseters for like TMJ symptoms, but it also shrinks down the masseters, so it kind of slims out the face a little too much. So in her case, I was noticing that she was losing volume in the mid-face, but her masseters were also kind of gaunting out a little too much. So in her case, we actually let her masseters go back to their baseline while we continue to balance her cheeks with filler. So like I said, I'm passionate about multimodal approach, and I think this kind of explains the reason why. She looks at herself on the right-hand side and she goes, yes, this is who I remember, not the person on the left. So this is a younger patient. In her case, she doesn't have too much volume loss because she's young, but she was really bothered by her asymmetry. So if you take a look at, it's her right side of the cheek, but on the photo, it looks like her left side. But if you look at the left-hand photo on her left side of the cheek, that cheek is a lot smaller than the right-hand side, and that really bothered her. So when she put on makeup, even though she thought she was putting on the makeup evenly, it just looked really uneven, and she didn't like that. So in her case, we weren't trying to get volume. We were more trying to work on symmetry, and you can see how much more symmetric she looks. The two sides of our faces are always sisters, not twins. We're never 100% symmetric, but we can get you closer with judicious use of filler. So this patient here, I also really like this photo because we only did filler to her chin. That's all we did. But she just looks a lot sharper and more lifted. So she has a little bit more of a recessed chin. She has these amazing cheekbones. She has great volume in the cheek. She has a nice sharp jawline, but the chin was kind of a little bit less balanced compared to the rest of her face. So we just did one session, one syringe of filler into her chin, and you can see just how much more tapered, sharp, and defined she looks. And finally, because we talked about lips a lot, this is an example. This is like one of my favorite lip filler cases because this beautiful patient, she just wanted a little bit, just a little bit more hydration in the lip, a little bit more pout, but she had realistic expectations. She didn't want big lips. She didn't want Kylie Jenner lips. She just wanted a little bit more of a subtle lip. And of course, with one syringe of filler, we got her there. Very natural. Her lips still move like she normally does. It doesn't look all plastic when she talks, but you can tell that it's a little bit more rounded, a little bit more supple to see it. Okay? So I hope that was helpful. Next steps. So thank you guys, as always, for coming during your lunch hour in the middle of the day on a Wednesday, no less, to come listen to me. But as a small token of thank you, mention you attended this session when scheduling a consult, and you can get half off, which I think is a fun deal. And see if filler is even an option for you. So I like to do a 360-degree consult. Anytime someone comes in for filler, I actually try to do a 360-degree consult to actually really determine what is bothering you and if you are a filler candidate to begin with. So as promised, feel free to take a photo of this or take a screenshot. These are some of the studies that I pulled the data from when we talked about kind of filler longevity and migration and all of that. Good. So that is it, you guys. I am going to go straight into questions. What filler is best for addressing asymmetry? Great question. And it's a good question because it depends. It depends on where the asymmetry is. So if I look at your face and I realize it is asymmetry due to bony structure, so for instance, to use me as an example, I know you guys can't really tell from the camera, I have a cheekbone that's higher on one side than the other side. If it is a bony structure issue, usually I will use a thicker hyaluronic acid gel that is going to help mimic that bony structure, okay? If it's lip asymmetry though, where one side of the lip is a little bit flatter than the other side, we'll actually take a look and say, okay, is it actually just a volume issue or is it a muscle yanking and pulling issue? So for instance, when you smile, everything is symmetric until you smile. Typically, it is a muscle yanking and pulling issue, so I'm going to address the muscle, not use filler to address the volume. But if it's truly a volume issue, I'm not going to use that same filler like I used in your cheek. That's crazy. I'm going to use a nice, softer, more mobile filler that will move with you to do the lip. Okay, someone says, you mentioned you're picky about who is a good candidate for under-eye filler. Can you give some examples of what you would look for in a good candidate? Great question. That's an insanely good question. I love talking about this. So under eye hollowing and darkness is multifactorial, meaning sometimes when you see darkness under the eye, it's actually not a volumetric shadowing problem. It might be pigment. It might be that the skin has thinned out around the eye so much that suddenly you can better see the muscle and the vessels underneath the skin, so it looks almost like purpley. If there's true volume deficit underneath the eye, and as we get older, what you're going to notice is, believe it or not, the openings on our skull where our eyeballs sit actually widen. And then because we start losing that volume in our cheeks, we suddenly see the kind of the difference between under eye area and then cheek. Usually what I do is I will make sure the cheek volume is already replenished. So if your cheek is really flattened, that's why we're kind of seeing that under eye tear trough, then I will actually target the cheek first, because by giving a little bit of support back to the cheek, sometimes that'll camouflage the under eye. If your cheek volume is good, if the skin thickness is good, there's no pigment under the skin, and you still see a little shadow, that person is going to be a better candidate for under eye filler, okay? If you have a true bag under the eye, usually the first line and gold standard of treatment is consultation with an oculoplastic surgeon for under eye blepharoplasty and fat repositioning. So I will send you there first unless you are not a surgical candidate. Can filler help with nasolabial folds? Yes, it sure can. Nasolabial folds are interesting because it's caused by a few different things. It's caused by you actually losing volume and support into the cheeks. So suddenly your fatty structures are shifting down and forward. So then suddenly things are falling forward. So with nasolabial folds, I will typically, again, if you are a candidate, do a little bit of structure back to the cheek first, and then fine tune into the nasolabial folds at the very end if we feel like we need to. If you have a lot of loose skin hanging over the nasolabial folds, I usually say, I have amazing plastic surgery colleagues that will give you a better result with a facelift if I think you're a better candidate for that. Another question, is filler or laser better for jaw sagging? Depends. if the jaw sagging is all due to like crepey, loose skin, a more aggressive laser, something like a fully ablative CO2, can actually pick that right up. However, as we get older and we lose that volume in our cheek and things are shifting down and forward, we will sometimes get this little pocket of fat called a jowl. I hate that we call it that, but you know, I guess it's accurate. But we get that little jowl pooch right there. The jowl fat pocket is actually its own little pocket of fat, and there's some studies that show that that fat increases in size as we get older. Other people think it's more of just the shift and change into our overall facial structure. So in the jowl area, usually if it's true fat, what I will try to do is actually camouflage that with a little bit of filler along the jawline, because as we get older, our jawline actually shrinks. So it's like a dining room table and then the dining room table cloth on top. But if the dining room table keeps shrinking, the cloth is suddenly now hanging, right? That's like something similar that's going on with the jowl. So sometimes I will camouflage it with filler that way. Okay, if it is a lot of fatty tissue, then sometimes we can actually use something to get rid of that fat. Now, if it's a lot of loose skin, a lot of fat, a lot of falling forward, facelift. That was great, you guys. Thank you so much for attending. Like I said, this will be available again if you guys missed the first half of it or anything like that. But that is it, you guys. Thank you so much for coming. I always so appreciate you guys, but I hope that was helpful. Take care. Bye-bye.